All right, we'll go ahead and get started here. Hello, everyone, and welcome. Thank you for choosing to spend your valuable time with us. Today's webinar will cover medical device security key strategies for cybersecurity and data protection, presented by wolfSSL software engineer Eric. My name is Emma, and I will be moderating the webinar. All attendees will be in listen-only mode. If you have questions, please use the Q&A box, and after the presentation, Eric will answer any questions. As always, all of our webinars are recorded and made available on our YouTube channel. If you'd like to stay updated with all the latest from wolfSSL, follow us on Twitter, connect with us on LinkedIn, and subscribe to our YouTube channel. Feel free to reach out to us via email at facts@wolfssl.com if you have any further questions. Before we dive into the technical presentation, I'd like to provide a brief overview of wolfSSL. Today, wolfSSL secures over 2 billion connections. We have more than 1,000 OEM customers and dozens of resellers. wolfSSL consists of over 50 dedicated employees, primarily engineers. This progress is, of course, supported by a strong partner network that we are very proud of. Since the beginning, our engineering team has developed several embedded security products, including wolfCrypt with DO178 support, FIPS certification and a FIPS-ready offering, MQTT up to the V5 specification, SSH v2, TPM 2.0, a secure bootloader known as wolfboot, Java wrappers and JSSC support, and commercial support for curl, and our newest product offering, wolfHSM. These offerings are accompanied by thorough maintenance and support plans up to the 24/7 level. We also offer full service consulting. And now I would like to turn it over to Eric to talk about medical device security key strategies for cybersecurity and data protection.
Excellent, thank you. So today we'll be looking at how wolfSSL products can help secure medical devices and some of the use cases we've had in the industry. For our agenda today, we'll look at the medical device landscape and some of the attacks that have happened recently. We'll go over the regulatory landscape, some of the security trends that we've seen, the use cases that wolfSSL has seen from some of our medical customers, and then we'll go through a couple of wolfSSL solutions that can be used in medical devices. Our SSL TLS library, wolfCrypt FIPS, wolfentropy, and our wolf bootloader, secure bootloader called wolfboot, and wolfSentry, which is our embedded IDPS solution. The three main areas of focus that wolfSSL covers are securing data at rest with wolfCrypt, securing data in transit. This could be on SSL or TLS or even SSH. Most commonly, this is over TCP, but it could also be a number of other different transports. And we've even seen use cases of running TLS over memory buffers, where there's no real transport layer involved at all. And then there's firmware updates, kind of a third category that mixes wolfCrypt with a secure transport medium, and also adding in a secure bootloader for firmware updates. This product slide is a good overview of our current lineup. You'll see here wolfSSL, it's our core product in combination with wolfCrypt, for either just crypto only or the full TLS stack. With wolfCrypt, we have a couple of validated and certified versions available for FIPS 140-3, which, by the way, was just completed validation process. We have a DO178C certification for avionics and also an asynchronous crypto module, which is meant to be used on the server side with cards like the Cadmium, Nitrox, and Intel Quick Assist. We have an MQTT implementation called Wolf MQTT for the client side and an SSH client and server library, a TPM 2.0 library, our secure bootloader called wolfboot, wolfSentry, which is an embedded IDPS solution, wolfentropy for random number generation, and our newest project, wolfHSM. We offer commercial support packages and consulting for the curl project. We also provide a version of curl that's been pared down for resource-constrained devices called TinyCurl. In the bottom left, here's a set of language wrappers for wolfSSL and wolfCrypt. The main libraries are written primarily in C, but we do have users that want to use us straight from Java or through the JSSE or JCE providers. We also have users who want to use this in C#, Python, and JavaScript. So here are a couple stats we gathered. As of 2023, there were approximately 190,000 distinct medical devices in US hospitals. And on average, there are 10 to 15 connected devices per patient bed. And that's just going to keep growing. More of those devices are being connected, and they have smart elements that are being integrated into the device. If we look at a survey, from the Palo Alto Network Unit 42 group that came out in 2020, it gives us kind of a good overall picture of what security looks like right now from their perspective. They found that 51% of threats for healthcare organizations involved imaging devices, and 83% of those medical imaging devices are running unsupported operating systems, meaning they're older or legacy OSs at this point. Of course, when you get into older software like that, there are more potential vulnerabilities that are going to be living in the software. And 72% of healthcare VLANs are networks with mixed IoT and IT assets, which oftentimes can more easily let an attacker in due to an insecure IT asset. Furthermore, 98% of all IoT device traffic is unencrypted. So obviously, there's a lot of room here to layer on security going forward. From the healthcare breach report in 2021, medical device attacks had increased by 55% in 2020. And we've seen vulnerabilities that have affected medical devices come out. A couple of those we put on the slide here are Urgent 11. This was 11 different VxWorks specific vulnerabilities in the TCP/IP stack, which were 0 days. And they were also found to impact several medical devices. Another was Swentooth. This was a Bluetooth SDK stack vulnerability that was also found in medical devices. These vulnerabilities are becoming at least reported more prevalently and becoming more public as well. Ransomware attacks have also been on the rise. We've seen a couple WannaCry ransomware affected some hospitals and medical devices worldwide. There was also a 2020 attack on a German hospital that resulted in essentially delayed patient care, where the patients needed to be diverted to another hospital. These attacks are becoming more frequent and, of course, more costly to the medical industry. As medical devices have gotten more complex and more connected, there are more layers of software involved and more attack vectors into those devices. When devices were simple and unconnected, there wasn't as much to worry about. But now that everything is networked, data is being sent to the cloud, to hubs, and to devices. There's a need to protect patient medical data. With implants comes a whole new set of attack vectors. And also, now that the devices are capable of being updated, we have to protect against malicious firmware updates going into the device. In fact, even the FBI has published recommendations to help protect the medical device industry. The key point there is that neglected software in medical devices is low-hanging fruit for threat actors. Without added security, your network is only as resilient as the most vulnerable device. As a result of these security deficiencies in medical devices, the FDA has published the Digital Health Center of Excellence, which provides some guidance for medical device cybersecurity. One of the drafts that we'll be quoting in a couple of slides throughout our presentation today is this guidance that was issued in 2022. So FIPS 140-3 is something that we've heard a lot about from our medical customers. It's a best practice for use with the HIPAA security rules. Anything Department of Defense related or government projects, they all require using a FIPS validated cryptography library. FIPS is often just a checkbox item, but it can be a deal breaker. There are some terms, other terms floating around. You may have heard things like designated for FIPS or FIPS ready. These are terms that some vendors like to try and use to meet a FIPS requirement, but since it's not actually a full FIPS validation, those typically aren't sufficient. In fact, those terms often get flagged when an audit happens. If we look into some of the current FDA guidance, which is from that document I mentioned on the previous slide, it does say to select industry standard algorithms and protocols and to select appropriate key generation, distribution, management, and protection, as well as a robust nonce mechanism. So the key takeaway here is to use modern industry standard protocols instead of legacy protocols or algorithms that are broken or have been found to contain vulnerabilities. The second item here is to use current NIST recommendations, recommended standards for cryptography. For example, FIPS 140-3 or an NSA Suite B or equivalent strength cryptographic protection. So that's where the FIPS would come into the picture as far as the FDA guidance is concerned in this case. Additionally, Section 3305 of the Federal Omnibus Bill specified that all new medical devices adhere to the medical device security requirements. This includes having a plan to monitor, identify, and address vulnerabilities and exploits. Also, there needs to be a method for updating devices to address any of those vulnerabilities and exploits. And lastly, an SBOM should be provided to help keep track of the software packages used in the device. So next up, let's look at some of the use cases we've seen from wolfSSL customers and some of the security trends as well. The first use case we'll look at was a patient care monitor. This project was used FIPS certified wolfcrypt and wolfSSH. There were multiple environments involved, including the QNX RTOS, Linux, and Windows. Both client and server side use SSH, all secured with FIPS certified cryptography. We developed the wolfSSH server daemon for this solution. Next up is an infusion pump, which was actually one of our earliest FIPS 140-3 projects. They used our FIPS 140-2 certification while waiting for the 140-3 code to be validated. The 140-3 effort actually lasted nearly 3 years, so we were very excited to announce its availability earlier this month. This use case is an endoscopic surgery device. The wolfSSL products used in this product are Wolf TPM, which is our TPM 2.0 library. Also wolfcrypt. This was for an Xilinx UltraScale Plus device, also running QNX. The customer is using that TPM 2.0 module for secure key storage, and this customer did have some challenges processing high volumes of streaming data, but using wolfcrypt and having our engineering team help them tune the library correctly, we're able to meet their processing requirements. This next use case is a dialysis machine, which used wolfcrypt, wolfSSH, and also wolfSSL. This was on an NXP IMX6 device that was using the CAM hardware crypto acceleration, specifically for ASXTS and hashing. This was running on Greenhill's Integrity OS, and here we had some engineering challenges getting wolfSSL integrated with the CAM device, especially on Integrity. We had to do some custom driver work, but in the end, we were able to provide a working solution to the customer. So in this case, when we used hardware crypto instead of using our wolfcrypt software crypto to actually call straight down to the hardware cryptography module, providing both performance increases and code size reductions. Also, for a lot of these projects, we have the benchmark data up on our wolfSSL.com benchmarking page. So you can actually take a look and see the performance difference that we reported in hardware versus software crypto. The next use case here is a portable defibrillator and ventilator. The wolfSSL products used are wolfcrypt FIPS, wolfSSL, and also our Python wrapper for wolfSSL. This was on an NXP IMX7 device running Yocto Linux. There were some open source parts used here with OpenSSL. So instead of compiling these against OpenSSL, the customer instead chose to compile them against wolfSSL. This was done to help meet FIPS requirements and for using validated crypto. They were using Nginx, Python's URL lib3, and also Python's WebSocket client. The next use case is an embedded and connected insulin pump. This used wolfSSL for TLS and was running on an STM32 device with ThreadX as the OS. I understand the customer chose us because they wanted a well-supported library that had a small footprint, and we helped them optimize the footprint to fit in their target requirements. The next one is a connected device hub. This we used wolfCrypt FIPS and wolfSSL on an NXP IMX7 again. This was another customer that had a FIPS 140-2 requirement. They needed to add authentication to the hub using TLS 1.3. And wolfSSL's had TLS 1.3 support for several years since it was standardized around 2018. And this project, the neuromodulation device, used Wolf Boot to allow the device to securely load a firmware image with free RTOS in the application. The cool thing about this project was that they were able to use the existing port of Wolf Boot for the Zinc Ultrascale, which really highlights the adaptability of the bootloader project. This is our last use case. This is a tablet that's used during organ transplants. This used wolfCrypt on an NXP IMX8 platform, again, taking advantage of the CAM hardware crypto. Here we focused our engineering effort on AES and ECC performance, helping to optimize some of the throughput. This also required us to do modifications to wolfSSL to work with the CAM on QNX. The tablet in this case is used to monitor other devices during the organ transplant process, and wolfCrypt is used to secure data in transit and also data at rest. So in reviewing these use cases, here are some of the trends that we've seen in regards to security. There are definitely a lot of customers who are looking to move to TLS 1.3 at this point. Securing data at rest with encryption, leveraging secure enclaves, secure key stores, or TPM modules when they're available on the platform, just to add in another layer of security robustness. Leveraging hardware cryptography to accelerate performance, and also supporting secure firmware updates and secure boot. This adds the ability to patch vulnerable software and extend the lifetime of that device. Next, we're going to cover some of the wolfSSL solutions that can help secure these types of medical devices. The first one of these being wolfSSL, which is, of course, our SSL and TLS library. So wolfSSL, the library, supports up to TLS 1.3 and GTLS 1.3 versions of the protocols. We've tried to keep the footprint size as small as possible. Typical build sizes range from 20 to 100 kilobytes, depending on build size and compiler and optimization level, of course. Runtime memory is anywhere from 1 to 36K of RAM per session. This footprint size is about 20 times smaller than compared to OpenSSL. So it's definitely going to fit much more easily on an IoT or embedded device. We support between 30 and 40 operating systems now, and that's growing all the time. Everything from your standard Windows, Linux, Mac OS through a bunch of RTOSes, and even down to just a bare metal environment. We have an OpenSSL compatibility layer that it's helpful if you're migrating from OpenSSL to wolfSSL, and that basically implements the top couple thousand OpenSSL functions and just maps them down into wolfSSL internally. We have ported a number of different web servers to use wolfSSL for the server side, things like Apache, Nginx, Lite, also Mongoose. We have hardware crypto support for a bunch of platforms now, and we can easily expand that whenever it's needed. We have our 140-3 validation for wolfCrypt. We've also done a lot of ports to different open source packages. We've seen this come up in medical devices with things like WPA supplicant, where a customer might want to add a FIPS validated crypto library into their Wi-Fi authentication. So now let's talk about our FIPS solutions that can help you meet some of your regulatory requirements. We have one active certificate for wolfCrypt FIPS on 140-3, that's certificate 4718. We have a couple more FIPS certificates pending, and that's going to allow us to help other customers down the road. The diagram here shows where the wolfCrypt FIPS module fits in relation to wolfSSL in the application. We've drawn our FIPS boundary around a subset of wolfCrypt itself, which means the TLS code is out of the validation scope. This was done by design, since most of the vulnerabilities and bugs that we fix and find are in the TLS layer, not necessarily down in the crypto level. So a FIPS customer can use the same FIPS validated library from release to release of wolfSSL TLS stack, still updating the TLS part of that library without invalidating their certified application. For new validations, there are a couple of solutions. We can add a new operating environment to our existing certificate. An operating environment, or OE, is a combination of the operating system, the processor, the platform, and the wolfCrypt version. We can also do a rebranding validation where we would rebrand our certificate in a customer's name. And then if needed, we can either grow or shrink the module boundary. That can sometimes be a little more of an involved process, but may be needed. It might be needed depending on specific FIPS requirements and, of course, time frame. All this is dependent on the scope of the project, the platform, if it's standard or non-standard, and what we're seeing as far as timeframes from the lab and the CMVP. So in the beginning slides, we talked a little bit about the engine and provider solutions. This is a really quick way for an application that's currently using the OpenSSL API, which may have a FIPS certified cryptography that's going out of scope or onto the historical list pretty soon, to switch over to wolfSSL and wolfCrypt certified FIPS solutions. It's super easy to swap out just by linking the new wolfCrypt FIPS solution. Then you can continue to use those OpenSSL APIs on the top from the application, and all the cryptography underneath is going to be using wolfCrypt FIPS. Alternatively, you could use the compatibility layer, which would keep the OpenSSL API in your application, but just remap those to wolfSSL APIs. The advantage here is that it allows you to bypass most OpenSSL specific vulnerabilities, as well as using the best tested TLS stack and cryptography. Another solution from wolfSSL is wolfEntropy. This is our software-based true random number generator. This project utilizes CPU jitter to generate high-quality entropy. This solution is focused on devices where a real hardware random number generator is not available. So even on older platforms, they can be updated to use wolfEntropy. The only requirement is that the hardware provides a nanosecond timer. Another critical feature with medical devices are secure firmware updates. All software contains bugs and vulnerabilities, so it's good to have a mechanism to enable updating software to fix vulnerabilities that are found. You can use firmware updates to rotate keys and certificates. These have the side effect of potentially extending the lifetime of your device in the field. And while firmware updates are great, even better is doing secure firmware updates, especially in life-critical applications. As you'll recall, the FDA document has recommendations that devices should be capable of being updated in a secure and timely manner. And to help out here is our secure bootloader solution, wolfboot. This is a lightweight and portable secure boot solution. It's fairly generic, it fits into almost any system, and we've ported it to a lot of different platforms. wolfboot uses safe code practices, and there is no dynamic memory use. It uses a dual bank update mechanism. So as you can see on the diagram at the bottom, there's a primary partition where the firmware would live, an update partition where the new update would go, and then just a small swap section to use during the update. It's interruptible, which means that if the power fails or something happens during the update procedure, it can just fall back to the original image. wolfboot has protection against downgrade attacks. It also has a rollback mechanism in case the update is completed and your application does its own internal checks and determines the update isn't valid. It can actually roll back to the previous image also. Since the bootloader is OS agnostic, we've enabled Wolf Boot on bare metal, as well as a number of RTOS environments. No specific hardware is required, although we can take advantage of things like hardware assisted features provided by that platform. And then another product is Wolf Sentry. This is our intrusion detection and prevention system. Intrusion detection can be interesting in the context of medical devices. If we look back to that statistic we saw earlier, that 72% of healthcare VLANs mix IoT and IT assets. In that case, an attacker might be able to easily get into an IT asset. So being able to monitor a device more actively with a firewall type solution and detect an attack that's actually happening could be beneficial if medical devices are exposed on that type of network. The benefits to using an IDPS include detecting malicious activity based on either static or dynamic rules. The application receives events that malicious activity is happening, which could then be used to do something with the information. You could log it in a history of events. You could send some kind of alert, or you could take some other kind of action. So to help facilitate this, we wrote Wolf Sentry, which is a universal dynamic embeddable IDPS. At its core, it features an embedded firewall engine, both static and fully dynamic, with optimally efficient lookups. Wolf Sentry is dynamically configurable and can arbitrarily associate user-defined events with user-defined actions, contextualized by connection attributes, tracking the evolution of the network transaction profile. And with developing these products is one thing, but we also want to make sure that we do as much testing as we possibly can to maximize the security of our products and also minimizing vulnerabilities, which helps our customers out in the end by having to update less frequently. Of course, we want to try to prevent crashes, which in medical device situation could be catastrophic. We do a lot of great testing every year, and we're always expanding it. We do everything from API unit testing to cipher speed testing and algorithm testing. We have a bunch of different static analyzers, including Coverity Scan and Facebook's Infer. We do memory error detection with Valgrind and fsanitize. Real world builds means we test our customers' build configurations on a nightly basis. We test with a number of different compilers. We have peer review on every line of code that makes it into the repositories. Third-party testing and fuzz testing with over 6 different fuzzers. All these tests are accomplished in a continuous integration cycle with Jenkins. This slide gives you a little glimpse at our software development process. Everything flows into the source code in the middle. On the left side, you have specifications that flow down into the software design documents, which are used in both API testing as well as implementation. And API documentation on the right side, module and algorithm verification, which is done by both our internal tools and by the NIST testing tools, by our validations and even other certifications. Another thing that makes wolfSSL stand out from other cryptography libraries is that we offer up to 24/7 support packages. Here are the 4 different packages we offer: basic, standard, premium, and 24/7. The benefits of each are listed out here. One of the huge benefits that I'd like to point out is that our premium and 24/7 customers can actually give us their wolfSSL build configuration, and we'll add that to our nightly tests. That ensures that any future releases of wolfSSL are going to build against your project. And the other important thing to point out here is that the higher packages include FDA audit support and even long-term support. And of course, we always offer free pre-sale support if you just email us at support@wolfSSL.com. We also offer a Kickstart program. This is the quickest way for you to quickly get your hardware and build environment supported by wolfSSL. It's usually about a week to get the library ported to your tools, OS, and hardware. That may or may not include validation if it's something that we already have on our certificate. It's a great way for you to get uh, it's a great way for you to free up your engineering resources to focus on what you do best. So, summarizing, why do people choose wolfSSL for medical devices? This is a pretty good summary of our discussion today. They choose us for our expertise and industry experience. We offer commercial support so we can help you get up and running with the integration assistance. We have a wide breadth of platform OS and compiler support, which means more times than not, it will just work in your environment. If not, we can help with a kickstart and get wolfSSL running in your environment as well. We have low memory use and small footprint size, modern protocol support up to TLS 1.3, FIPS validated crypto, hardware crypto support, as well as support for secure elements and TPM 2.0 modules. We are the best tested crypto and TLS implementation available in the market today. Our full product suite is available to help secure your medical device project. Hopefully, this was helpful to give you an idea of some of the places wolfSSL is used in current medical devices and how we might help out in future medical devices. And with that, let's open it up for questions.
Amazing. Thank you so much, Eric. To kind of kick us off here, how long is the FIPS certification valid?
Okay, so the current FIPS 140-3 certificate that we got is part of the new FIPS 140-3 program. That includes a 5-year lookout date from the time the certificate's issued until the time it sunsets. So we're looking at 2029 will be the validity period.
Perfect. Another question here. Does the Wolf Sentry come with a consolidated management console? And then how is the firewall blade being managed?
Yes, those are good questions. It's not a hard firewall process. And invite you to actually go check out the repository to get a better idea of exactly what using Wolf Sentry would look like on an embedded device.
Awesome. And then do you have any examples of enabling TLS?
Sure. So besides the project itself ships with a number of examples and demonstrations, but we actually have a full repository of just examples and demonstrations. That's available on our GitHub page also. Um, so I would invite you to check that out. There's everything from doing a simple, if you have a simple TCP application, converting that to use TLS, all the way through doing things like certificate analysis and generation, key management, file encryption, decryption. So lots of great examples out there.
Perfect. And then roughly how much would you say licensing costs are?
Hmm. That's a little more in depth than we wanted to go into in this webinar. I would invite you to contact our sales business directors at fax@wolfssl.com.
Perfect. I think that wraps up all of the questions. Thank you, Eric, for hosting an informative webinar. Thanks everyone for joining. I will email a copy of the webinar, including and PDF recording and PDF slides. You can keep up with our upcoming events, meet our team in person, read our blog posts, and get the latest Wolf SSL updates by following us on X, connecting with us on LinkedIn, and subscribing to our YouTube channel. If you have any questions at all, don't hesitate to shoot us an email at fax@wolfssl.com. We're here to help. Thanks again, and we look forward to seeing you next week on August 7th for how to determine FIPS compliance for government buyers. Thank you all.